For many centuries, natural and man-made disasters have occurred around the world. From wars to earthquakes, disasters have wreaked havoc and have destroyed the lives of many. Research has shown absolute numbers of injuries, as well as injury-to-death ratios, in natural disasters have increased significantly over the last 40 years. Both governmental and non-governmental organizations have become more sophisticated and organized in both the preparation and response stages of disasters. But the traditional response to disasters have largely neglected rehabilitation as a strategic intervention. As a result, physical therapists are not routinely placed on emergency response teams. The earthquake in Haiti 5 years ago and Nepal this past April were catastrophic events that demanded the response of all medical personnel. In particular, physical therapists played vital roles in managing acute conditions such as fractures, traumatic brain injuries, spinal cord injuries, among many others, and were instrumental in providing post-operative care as members of orthopedic surgical teams. Physical therapists also provided care and advocated for the vulnerable, people with pre-existing chronic health problems and disabilities, for these people are more likely to die in a natural disaster. Physical therapists' efforts during these events resulted in reduced medical complications, improved patient outcomes, and they help lessen the burden on an already weak healthcare system. It is believed that as a result of recent disasters and the added benefit of physical therapists during these events, participation has increased. To what extent and in what capacity is largely unknown. Through an extensive search of the literature and expert interview, this descriptive study will explore the types of disasters physical therapists are currently participating in, and will explain in detail the capacities in which they are working. This information will be distributed professionally in a variety of mediums for awareness and advocacy purposes. This initial description will provide a foundation for future study to investigate in more depth the barriers to participation, with the goal of developing guidelines for the inclusion of physical therapists on disaster teams. It will also pave the way for exploring the collection of outcomes data that will aid in objectifying the impact of rehabilitation services during the acute stages of a disaster. The third stage of this 3-year project will be to use the information gathered during the initial stages of this project to help establish a rapid response team in the United States in collaboration with a well-respected disaster management organization, such as Handicap International, International Medical Corps, United States government, among others. This project is unique to the profession of physical therapy in the United States and is an opportunity for those involved to be a pioneer of sorts in helping establish physical therapy as an essential profession to include in the response to future disasters around the world.